Hi, I'm Kelly, a registered respiratory therapist with BluZone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.
Hey everyone, how are you guys doing? It's September in the Cozy Lung Lounge, and I don't have much of a voice today, so I'm going to try to get through this. I'm here with my co-host, Amy.
Hey everyone, it's Amy, and we are missing Kelly today. She is out of town, but we are going to be talking all about exacerbations today and how to handle an exacerbation. So we're talking about COPD and just exacerbations in general. We want to go ahead and get this started off with the theme of early action equals fewer hospitalizations.
So exacerbations is something that a lot of people talk about. They don't really know what that word means, exacerbation. It just means a flare-up. So what do we do when you can't catch your breath? What are the early warning signs of this flare-up that we call an exacerbation? Like you said, early exacerbation really leads to fewer hospitalizations. Listen to your body and the signs and symptoms that we've talked about in previous episodes. With COPD particularly, 30 to 35% of COPDers will have an exacerbation each year. The more exacerbations a person with COPD has each year, the higher their mortality and the lower their quality of life. It's really essential to keep your lungs protected from flare-ups.
Absolutely. And there's three main warning signs of an exacerbation occurring. So the first one is to look for an increase in shortness of breath. So there is some shortness of breath that comes to day, especially if you've got a chronic lung disease. But if you start to notice an uptick in that shortness of breath, maybe you're using that rescue inhaler more often than you feel like you should be, or more often than is normal than for you, that's one thing to look out for. And that's definitely why we recommend keeping a symptom journal. So keeping a journal of your symptoms and fully understanding what you're going through day in and day out so that you can look for those changes.
I wear an Aura ring, the OURA ring, and it's a smart ring. It tracks all kinds of symptoms and things. My ring has told me more than once that I'm sick before I knew I was sick. It says, hey, your body temperature is going up a little bit. You're a little bit more restless. And so that's really an easy way to keep track of my symptoms. It just does it for me. But really, those symptoms are really an important piece of to identify that. Once you know you're having problems, what are we going to do about it? Well, you should have your trusty action plan. So I pulled a couple here. We've got this one's from the American Lung Association. This one's from the Bronchiectasis Network. There's some for pulmonary fibrosis or asthma, whatever you have. This is something you should have already done in conjunction with your doctor. So most likely it's going to say grab your rescue inhaler. Take 2 puffs of albuterol, for example, using your spacer. Good technique and nice, slow, deep breaths. Your action plan may say something else, like take an antibiotic or take a smart inhaler, which also has a steroid in it. Follow that plan. If it says call the ER, do that. Talk to your provider about what they would like you to do in a case of a flare-up.
Absolutely. And those action plans, like we said, should include all of the different warning signs. So including that increase in shortness of breath, including changes in your cough or sputum. Maybe you're having thicker mucus productions or different colored mucus productions, and also a change in that energy level. So I know you said your Aura ring tells you when you're not as restless, maybe when you're not moving around as much, when you have lower energy, when that core temperature is up, or even if you just have a really big decrease in your appetite. I feel like that can happen pretty frequently. And that's another thing to look at that should be included in your action plan, looking and monitoring those symptoms and then going through the procedures in your action plan. And that's why they're so important, just so you know exactly what to do whenever those changes do occur, so you know how to make sure that we prevent a full-on exacerbation from happening.
You've heard this before, but we'll say it again. You need to know which inhaler you need to grab in the case of an emergency and which you're taking every day for maintenance. And so if you're taking your maintenance inhaler every day like you're supposed to, and you're good, and all of a sudden you're not, well, that doesn't mean that maintenance inhaler is not working anymore. It just means your body's something else is going on. And that's when you may need to take that rescue inhaler more often, when the symptoms aren't being relieved by your maintenance inhaler.
Absolutely. What is the difference between maybe an exacerbation and getting sick, and maybe in just a worsening of condition and needing an adjustment in your medications?
Boy, that's $1 million question. The gold guidelines for COPD would dictate that. So there's a very long piece of information that everybody can access freely on the gold, I think it's gold.org. I'd have to look that up. But there's all those guidelines, and your doctor should follow those. And it's an increase in sputum production. Might have a fever, those sorts of things. There's certain criteria that go into that exacerbation. Now, if you're just having a worsening of your COPD, those things come on gradually. You may notice over 2 to 4 months that you're a little bit more short of breath walking to the mailbox. Those sorts of things would come on more gradually. If it's a seasonal thing where you have the harvest outside, it's September, we're starting to get into that sort of thing. If that's bothering you, that might be a reaction to the harvest, causing a reaction that way. Now, it could lead to an exacerbation if it flares up and causes more problems, but that in and of itself is not an exacerbation. But you have to really watch your symptoms and know which pieces of your plan work for that.
I kind of want to go through just everything that goes into an action plan. And then from there, I think it'd be really good just to talk about some ways to help prevent an exacerbation from happening. Also, looking at different lifestyle things you can do just on your day in and day out to keep yourself feeling good, to keep yourself feeling healthy, and to help prevent those exacerbations. So with that action plan, just in case of a concern or an exacerbation, the first thing to have is personal details in that action plan. So that would include things like your name, date of birth, contact information, and then also just a medical history. So a list of all of those medical conditions that you have, to make sure that if somebody does need to give you medical attention, that they have the full list of details, so they're aware of what they need to do.
That's really important. The healthcare workers will use that, particularly if you can't breathe, and the ambulance attendants or the emergency medical personnel. It'd be nice to have that for them to read, and so you don't have to worry about breathing when they're there to help you out. The second thing you'll want to do is know your usual symptoms. So we find this a lot of times in the hospital. Patients will go in the hospital and will be very concerned about things, but those are things you live with every day. So we really want to know, how breathless are you? Can you walk 100 feet or not? Is your pulse ox normally dropped to 87 going to the bathroom on 3 liters of oxygen? Write that down just so we're aware of that.
That's a good thing to have maybe a journal for, or a notebook. And then when you kind of have learned your routine, you learn those normal symptoms, you can write that into your action plan and just say, hey, this is my usual, this is what generally happens on my day to day, so that we know exactly what to expect. And not only can we know what isn't an emergency, but healthcare professionals can tell what is an emergency, what is beyond your normal symptoms. And then the next thing would be a medication list. So medication is not just pills. Medication also includes your inhalers. And we don't want to know just the names. That would also be important to add in your dosages, as well as the frequency, how often you're using them, and how to administer that medication.
Now, we talked about journals. You can have any sort of thing for a journal. I've got this little book here. It's one of those things that one of my coaching clients would get a personal journal like this from me if you're one of my clients. But having all those things written down is so important. Your symptoms, the medication list. You may be doing medications a little differently than prescribed. Write that down. If you're taking it your maintenance medicine once a day rather than twice, write that down. There's no judgment. We just want to know the accurate things. And something else you could put in that journal, your known triggers. Are you allergic to that harvest that's happening right now? Smoke, weather conditions right now. There's a thunderstorm coming into my neighborhood that really would exacerbate some people's breathing. And so those kind of things are important, little things that you might not think are important, but the clues are really important for knowing if it's an exacerbation or if your condition is worsening.
Absolutely. Yeah, that really hot, hot, or that really cold, cold, super dry air or super humid air. All of those things, those kind of extremes can be really difficult for people. And I think it's different for each person. So it's important to note which one affects you the most and to pay attention to that. So the next piece we have is action zones. So this could basically just give you a guideline for what to do based on your symptoms, based on how you feel. Have a few different plans. So we can break it down into colors. So you could have green, yellow, and red. Green would be when your symptoms are minimal. That's just kind of your day-to-day. You're feeling pretty good. Your maintenance medication is working. We have your yellow, which is kind of a plan that you need to get put together for when your symptoms are starting to worsen. So this is when maybe that exacerbation may be about to happen, when something just doesn't seem quite right. And there's a few important things to note on there. So Gina, what do you think you would do for that yellow section?
Well, in that yellow section, like I said before, the rescue inhaler is super important to have that, whatever medicine you need. It may be a different kind of medicine if you need something for anxiety. Maybe you have Ativan or something like that that the doctor has prescribed for you when you're having those kind of problems. How do you know if it's breathing or anxiety? Well, you can sit and do some box breathing or some little simple breathing exercises. Just for 1 minute, try to slow your breathing down. In slow, deep breath in, and then blow out through your lips, nice and slow through those pursed lips. Try to relax yourself for just 1 to 2 minutes, and then just see, are you feeling a little better after that? Or is your chest still tight and you still need to do more things? And so that will let you know if it's some of that. But the rescue inhaler, the breathing exercises, and really your plan with your doctor, what to do in a case of an emergency.
Hi friends, this episode of the Cozy Lung Lounge is brought to you by Hootenanny Joy, where your health and wellness take center stage. At Hootenanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootenannyjoy.com to explore the programs and choose the one that fits your journey best. Hootenanny Joy, because your health deserves a little joy.
And then for our red section, that's where you're having severe symptoms. So that's when, we really are having an exacerbation or we're having a more immediate health crisis. And this is when to call 911, when to call a healthcare professional. Sometimes in the red, there can be a differentiation between just needing to call your primary care physician and getting a medication order put in, or if this is a 911 emergency. So that's what kind of goes into the red section. So that's really when you need help. And you want to have contact information for your healthcare professional, so your physician, your pulmonologist, and as well as having all of the contact information for where you would like to go for emergency services.
I'll go ahead and read off the symptoms that are on my action plan that I have here in front of me. This one happens to be from the American Lung Association, a really good resource. Severe shortness of breath, even at rest. Not able to do any activity because of breathing. So you can't even get up to walk to the bathroom without shortness of breath. You can't sleep because of your breathing. You've got fever or shaking chills. Now, take that with a grain of salt. Every fever is not going to be a 911 call, but you know the difference between a bad fever and a not. If you're confused or drowsy, that's really a trigger to call 911 because your carbon dioxide might be going up or you might be getting sepsis, both of which you really need at the emergency room to deal with. Chest pains that are different than normal, and coughing up blood. And so, again, coughing up blood is not a spot here or there, but a larger amount of blood. If you've got a spot of blood that you're coughing up, please talk to your medical provider about that, but that probably is not a 911 call. So again, kind of realize what your baseline symptoms are, and if these are just scary that you want to call your doctor, or if the ambulance should really come out. Now, we've not talked about oxygen levels. Many of you have a pulse oximeter in your medicine kit. And so, of course, 90 and above is normal. In the 80s, it's going to be a gray area, and that's where your action plan comes into play. Definitely, if you're in that low 80s and below, that needs to be a 911 call if you can't get your oxygen up. But that gray zone in that middle 80s, that's really a provider thing that you want to talk about on your action plan.
And that kind of goes into the emergency procedures. So now that you've kind of identified what zone you're in, if you're in the red, what are those emergency procedures? And that goes into your oxygen levels too. When do you call 911? Or when do you call your physician for that medication adjustment? And then you can also add into that your oxygen use. If you are on oxygen, maybe you're not on oxygen 24/7, but just kind of like as needed with exercise. That's an important thing to add into your emergency procedures. So when your oxygen drops, when do you put on your oxygen? When do you turn up your oxygen? So all of those things are really important to put in that emergency procedure list.
That's a great thing to mention, because if you're a COPD patient, you're probably going to be using a lot lower level of oxygen, maybe 1 to 4 liters. If you're a pulmonary fibrosis patient, on the other hand, you might be using 8 or 10 liters with exercise. And so having that as your baseline, we need to know that, so that if your pulse ox is only 90% and you're usually on 2 liters, but it's 90% on 8 liters, that's a very different thing.
And then our last thing for that action plan kind of goes into what I wanted to talk about next, which is our self-management strategies. So this is kind of for your non-emergency, when you just want to figure out what strategies work best for you to manage your condition overall. So whether you have COPD, asthma, emphysema, pulmonary fibrosis, pulmonary hypertension, you want to know exactly what types of things work best for you. And that's an important thing to add into your action plan. So just knowing what works best and having it written down can help you remember. So whether that's those breathing techniques that you can use daily, whether that's exercises that help you stay calm, so maybe some gentle yoga or mindfulness exercises. What exercises are good for you to help keep your lungs healthy and to keep your overall body healthy. So going through endurance and strength and balance exercises. And then we also have nutrition. So it's important to note maybe what foods make you feel better or make you feel worse. Some people notice they have more congestion and mucus when they eat higher levels of sugar and carbs. So it's important to know what nutrition works best for you. And then also smoking cessation is another really great thing to add into that self-management, as well as infection prevention, which can be wearing a mask and, going through those breathing techniques to keep your lungs really nice and clear, keep lots of fresh air moving. What other self-management strategies or suggestions do you have?
Well, you just hit the nail on the head with that mucus. We didn't talk about that much, and that's a key indicator of an exacerbation. Changes in your mucus. Is it thicker than normal? Are you having trouble getting it out? Is it different colors? Is it getting darker yellow, green? Any of those colors would indicate infection. So those are all signs of an exacerbation. So yes, very important to watch your mucus. On a normal basis, you want to keep it cleared out. A lot of cough and deep breathing, maybe a flutter valve of some kind, or the vibrating vest if you're so lucky to have one of those. But any of those kind of things would really help. So watch that mucus. If it's not normal for you, then you need to make sure you report it.
So that's pretty much all of the things that we recommend kind of going into an exacerbation plan. So going into that action plan. So next I want to talk about who should have one of these plans, who should have a written copy and a printed copy of this And that can be whoever you'd like. So you yourself should have one or more than one around the house. And then also your doctor and your physician should have one, whether that's your regular primary care or your pulmonologist or both. And then a trusted family member or friend, most likely more than one, whoever you are comfortable with sharing that information and having a printed copy of that. That would be another great resource just in case of an emergency.
Most doctors will want to scan it and put it in your electronic medical record, so it will be there all the time. I also have this little one of these plastic savers with my action plan, so that the asthma action plan that we use in our house is kept with the inhalers in the medicine cabinet. So we have it there in our house. The asthma action plan has a peak flow component, so that peak flow meter would also be kept there. Now, COPD action plan, you would not have a peak flow meter with that, but you might have your pulse ox there, kept it with the action plan. So it's all there together so that you can refer to it frequently. We've talked a lot about this action plan, but it really is key to track your symptoms so you know when there's something new going on with yourself.
And I think having everything written down and having everything organized, knowing your symptoms, knowing what to do when something just doesn't seem right, can really help with the anxiety piece of it all. Because I know a lot of times when you're having shortness of breath, you're having those pulmonary symptoms, maybe that's chest tightness, maybe that's increase in mucus or wheezing. You can feel a lot of anxiety with that. A lot of anxiety goes with not being able to breathe. That's a really scary feeling. And so having that plan and having everything written out and organized may make you feel a little bit more confident and comfortable in a pretty uncomfortable situation. So, and it can also make the people around you feel a lot more comfortable and confident that they can help you and make sure that everything is okay.
Well, we sure have covered a lot of good information today. Now, everybody's going to have flare-ups. It's just part of life. Everybody gets a cold in the wintertime. And as best as you try to prevent it, it still happens sometimes. So if you're prepared, you can get through that and minimize any long-term impact from that. So yeah, be prepared, expect them, hope you don't get them, but let's be prepared ahead of time.
Absolutely. And I think preparation is key. So they do happen. It's nothing to be ashamed of. And it is pretty common. So that's why we just like to have these action plans just to see if we can prevent them from fully occurring and kind of try to help prevent a hospitalization from occurring. So I hope all of these things are really helpful for you just to kind of consider and go through. And if you guys need help with this, we do have coaching available through our sponsor, BluZone Health's website. So please check out our coaching. Gina is one of our health coaches as well as Kelly. So they are here to help you build those plans and to talk through everything. You can even bring a trusted family member or friend who you want to know your action plan onto those coaching sessions to help you get everything sorted out.
That's my favorite kind of coaching session because we both have a plan that we're looking at and following through and talking about. And your doctor definitely wants to be involved in that. But it's been my experience that the patients who bring these ahead of time, knowing what's on the plan and prepared to talk to their doctor, have a much better time in that doctor's visit. And there's even physicians that are really not familiar with action plans. And it's a good way to open the dialogue between you and your doctor. So I'm happy to help you go through each step by step, each line to talk to you about your options. Now, I can't help you create an action plan because that's your doctor's responsibility, but I can tell you what each line of that means, and we can learn about vocabulary and your disease process together.
Well, thank you guys so much for joining us today on the Cozy Lung Lounge. And I hope these action plans and going through what to do with an exacerbation is helpful. And we will see you guys next time. We're going to be talking about our social life living with COPD. So we're excited to see you guys. It is almost Halloween for our next episode. It's coming out the day before Halloween. So we'll see you then.
Bye, everybody.
Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At BluZone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit BluZone.health and take the first step towards stronger lungs and a healthier future. BluZone Health. Breathe better, live better.